which is developed by the Screening for Mental Health, which is a national nonprofit. They're actually located in Massachusetts. And as it says, they're really out there to provide information on mental health and substance abuse resources across the nation. So that's really their focus. And they developed this training, this curriculum really, to address the issue of suicide. So Signs of Suicide itself has multiple components. Tonight you're getting the Trusted Adult training. It also has a training specifically for schools, middle schools and high schools. And you'll learn more about what Springfield Public Schools is doing to implement that youth training later tonight through our panel discussion. So it's the same organization that has the Trusted Adult training that we're also going to be implementing in Springfield Public Schools. And then they have, a Train the Trainer. So this is a really, really great organization that's been working on this issue for quite a while. As far as community partnership of the Ozarks, we're a local nonprofit that we're really all about discovering the needs in communities and rallying a discussion around those to try to solve those problems. That's kind of where we are couched in, whatever that issue would be. I specifically oversee drug and violence prevention efforts and mental health promotion and suicide prevention in 21 counties. So we cover a wide expanse of Missouri, and we are working on this issue of suicide hand in hand with so many great partners, and so that's part of the work that we do. So what we're going to cover tonight is this youth suicide topic. We're going to go over some different myths and facts and some statistics, even local statistics that you'll be able to walk away with. If you want to take notes, there are pads of paper and pen in front of you, so help yourself to those at your table if you want to jot some of these things down. And then, of course, we're going to talk about what parents, teachers, fill in the blank, whoever your role is with youth, what you can do on this issue of suicide, and then of course we'll do some local resources and then our Q&A session. So let's look at some youth suicide, and we're going to start with myths. The most important myth that I bring up tonight is that talking about suicide gives them the idea of suicide. The opposite is true. Bringing it up can actually provide relief. It can actually allow that student to have an opportunity to talk about how they're feeling and not feel judged. So having the conversation about suicide will not plant it in their heads. I heard it said by a survivor of suicide, I heard them say, it was already in my head, so they didn't ever put it there. They never put it there first. I had thought of it first. And so having that conversation is so essential. How many people have heard this myth, just to kind of get an idea? Have most people heard this myth that you shouldn't talk about it, right? Because we put that idea in. Yeah, a lot of hands going up. So this is a common myth that we wanted to start with and just debunk tonight, because truly this is where we have to start our conversation, is that it's okay to talk about suicide. It's okay. It's the right thing to do, so that you as a parent or a teacher or a counselor or a pastor, you are the first one having those conversations with them. They're not talking about it with their friends or with social media. They're not learning about it through a TV show. That they're talking about it with you, and you're having those conversations, and you are that trusted adult. So this one is really, really key. The next myth I want to cover is that if a person is determined to kill themselves, there's really not that much that you, me, anyone can do to stop them, right? They're determined to kill themselves. Anyone heard this myth? That it's just they're committed to it? Yeah, see hands. So truly, even the most depressed person is going back and forth on whether or not they want to die up until the moment they attempt. And the truth is that most people don't actually want to die. They want that pain to stop. They want to stop feeling as bad as they are feeling, and so because of that, suicide has become an option. But the truth is that conversations, therapy, things that they can work through to overcome these feelings are a solution. That depression is treatable, and so it is not something that they are just determined to do. The next myth is that teens are not really depressed. They are just growing up and they get all emotional, right? And that's just a common teenage thing, and we shouldn't really worry too much about that. Anyone heard that myth? Right? Yeah. Again, depression's not just something that they've made up. It is a serious mental health issue that is treatable but needs to be treated. And so youth and adults can both need professional treatment as they work through how they're feeling, and then they can come out on the other side of that and live a completely healthy and productive life. And so it's important to know that this is not just some adolescent fad that they're thinking through. If they truly are struggling with depressive thoughts, it would be great to get them connected with someone that they can talk to about that. So what I'm going to shift into now is kind of a true or false. You didn't know you're going to get an exam when you came in, but you are. So I'm going to make you kind of give a little feedback to me here. So tell me if this statement is true or false. 1 in 20 adolescents have a diagnosable mental health disorder. True or false? I'm hearing both. It is a matter of numbers. So it actually is false, because the truth is that 1 in 5 have a diagnosable mental illness. So it's actually more common and more prevalent than you would think. 1 in 5. So you start thinking then, right, about your children, your children's friends, and that kind of helps to bring it in. Or if you're in a classroom of 30 students, that means that 6 of them have a diagnosable mental health disorder. And then it's interesting is that out of all of the mood disorders, 1/3 of them emerge during adolescence. So how much more do we need to be paying attention to what's happening to our kids and not writing it off as being, it's just teenage angst. It's just them feeling all of those hormones in their body, right? We have to look at these studies. These all have references. These are things that have been proven to be true. So then the false thing disappears. Here's go with the next one. Approximately 50% of school-age children with mental illness go untreated. Do we think 50% go untreated? True or false? Higher? Yeah, it is higher. You're correct. So that's false. At least 70% of school-age children go undiagnosed in their mental illness and don't receive that treatment. So again, as we're seeing this, 1 in 5 have a mental health disorder, a diagnosable mental health disorder, but 70% of them are not receiving that treatment. So this is definitely a gap, and we have to, as a community, reduce stigma around mental illness so that these kiddos can get access to treatment and help without feeling like there's something wrong with them. Our next true or false is that the prevalence of depression in adolescents and young adults is increasing. True or false? True. Yep, absolutely. This one is true. It actually has increased from 8.7% in 2006 to 11.3% in 2014. So over an 8-year time period, it's increased that much, and that's a national statistic. And last one that we'll cover, suicide is the 3rd leading cause of death among 11 to 18-year-olds. True or false? Yeah, you're right. That's false. It is the 2nd. It used to be the 3rd, but it has actually overtaken the 2nd to be the 2nd leading cause of death among 11 to 18-year-olds. So have I laid out a good enough case that this is an issue we need to be talking about? I think so. This is a national study that is done. It's the Youth Risk Behavioral Survey, and this is a nationwide survey. So this is across all of the U.S. Questioning students. And so 29.9, so 30% of our U.S. high school students felt so sad or hopeless for over 2 weeks that they stopped doing some of their usual activity. And I'll cover this again on another slide in a few minutes, but that's one of the key warning signs, is if you see them withdrawing from things that they usually enjoy, that's a warning sign. Almost 18% seriously considered suicide. 14.6% made a suicide plan. 8.6 attempted, and 2.8 had an attempt that required medical attention. So these are sobering numbers. Let's bring it home a little bit. Here's Greene County students, 2016 and 2014. So you'll see in every column that has increased over the course of 2 years' time period. So students seriously considering suicide, 16.6. Here in Greene County. And this is a self-report survey. This is students reporting how they are feeling, but that number has come up from 13.3 to 16.6. 12.3 have made a plan, and the reason why that question is significant is because typically, and we'll talk about this in a minute, you want to ask them the question, are you considering suicide, or are you thinking about killing yourself? If you are seeing these warning signs, you want to ask that question. If they say yes, your next question is, do you have a plan? Have you made a plan? Do you know how you would do it? Because that kind of helps us to understand the gravity of the situation that we're working with. No matter what, a yes, I'm considering suicide needs to be addressed. But if they have made a plan, then that becomes a very, very, very urgent matter. We've had 6.8% of our Greene County kids attempt suicide one or more times. This is in the past year. And then 1.3 resulted in injury. And I will tell you this, we have it compared by Greene County because I wanted you to see that the prevalence rates of our local kiddos is rising. However, I will also add that the Missouri numbers, Greene County is higher than the Missouri numbers on most of those. So our region has some youth who are definitely needing some trusted adults. So let's talk for a second about risk factors. There's an idea between risk factors and protective factors for children who are growing up. We want to reduce the risk factors and enhance protective factors. Risk factors are things that are either inherent in an individual or in an environmental situation that put them at higher risk of something. In this case, we're talking about suicide. Now, it's important to note that a risk factor does not equal a cause. There are a lot of reasons for why a youth would consider an attempt suicide. There are a lot of reasons for that. Risk factors, there are a lot of risk factors. There's never just one. So it's important to note that, and I have that on the screen. But I gave some examples there of some things that would be risk factors. So they could involve things like substance use. We'll talk more about that in just a second. Feeling hopeless, having a low self-esteem. Adverse life experiences and circumstances like bullying or exposure to a peer suicide can put you at higher risk. Family characteristics, if there's a history in your family of suicide, if there's a history of mental health disorders, and then of course in the environment, which would be the Springfield community. If we have a high stigma around mental illness, that is a risk factor for our youth because they're not going to seek treatment as often as they maybe should because they feel like there's a stigma associated with that. So that falls on us to make sure that we're reducing stigma around mental illness. And of course, lack of access to mental health care. So these are some things that can increase someone's risk for considering suicide. As far as depression in youth, it's important to note that not all people who are depressed are suicidal. But a lot of people who are suicidal are depressed. So I'll say that one more time, make sure you follow me. Not all people who are depressed are suicidal. But a lot of people who are suicidal are depressed. And so depression plays a very key role in preventing youth suicide. It can occur in teens who seem to have it all together, right? Their peers may boast about how they were the smiling beam of sunshine every day, and it just took everybody by surprise. It could look like they have everything in life together. So that needs to be noted, that depression can even hit the kids that maybe we write off as just being they're okay, they're good, right? A depressed or a down mood in adolescence can look like irritability. And I know, again, this goes back to like what's normal in adolescence versus what's a problem. And you say, well, my teenager is always irritable. I know, they are, but this can be a sign of some major depression. If you've noticed a mood change that's happening before your eyes, that would be a sign to look for. And then of course, if they're struggling with depression, they oftentimes manifest in a physical way first, right? They have stomach aches, or they complain of having body aches and that kind of thing. So look for those unexplained issues that they might be having physically. As far as a major depressive disorder, this is a DSM-5 diagnosis, and it involves, again, that period of 2 weeks where they are feeling depressed or loss of interest or things that they normally would have really enjoyed, activities in their life. If they've pulled away from those, and then there's several other symptoms involved in that, That's what quantifies this diagnosis. Now, I am here to tell you we can't diagnose unless you have a doctorate to be able to do that. But these are just up there for you to understand that depression is something that we need to be mindful of as parents and those who are involved in the lives of youth. So there's a specific population within, or are some specific populations within youth who are more perceptible to experiencing suicidal ideation and thoughts. Alcohol and drug use has a big deal to do with that. Like I said, I'm going to talk about that in a slide here. Non-suicidal self-injury, if they're in a population of being lesbian, gay, bisexual, transgender, or questioning, that would be also a population that is at higher risk. Again, this will follow with several slides as I talk about these. If they are homeless or in an out-of-home setting, that can be a population of youth that are more at risk because they may be lacking structure, they may be lacking caring adults that are trusting of them, medical conditions or disability, and then of course if they have been personally impacted by suicide. So let's look at some of these. So alcohol specifically is strongly associated with suicide among adolescents when they are drinking, when they're feeling down emotionally, or they've got kind of like, it says heavy episodic, so think binge drinking, right? So if they are consuming a lot of alcohol in a short period of time, or if they start drinking because they're sad, there is a direct correlation between that and them considering suicide. So why is this the case? Well, I've got a couple reasons up here. One is that it increases their disinhibition and their impulsivity. So youth are already rather impulsive. However, when they start consuming alcohol, which we joke around as being liquid courage, it's the same concept, right? So it's going to lower those inhibitions and increase that impulsivity. Increases aggression and maybe a negative affect. They're may become more negative in mindset when they drink, so that has a big piece to do with it. And then this thing called cognitive constriction, which basically means it says restricted production of alternative coping strategies. So it's kind of like, think of it this way. It's like all of a sudden they get blinders on and they can't really see anything outside of those blinders. Cognitively, they're only thinking about what's like directly on the front of their mind. They're not really able to consider other options, which is what makes them more susceptible to suicidal ideation. So there's a 75% increase in risk when youth drink alcohol while they're down emotionally in their mood. And overall, substance use is higher for individuals struggling with another stressor. So if they already have depression or anxiety, alcohol consumption kind of exacerbates that. And so it's important here that as a parent, you are talking to your kids about alcohol use. And that's the only drug that we really cover in this training. Like I said, I do drug prevention, so if you have other questions about other drugs afterwards, I'd be happy to answer that. But alcohol is the #1 drug that's abused by our youth. And so this is a very, very important point to make, that you're talking with your teen about alcohol use and consumption and what that can do to them and their bodies. Most of my experience in talking with youth about this, they say, just be real with me. Don't tell me it's going to be a miserable experience, because I see people having fun and doing it all the time, and no one would want to do it if it was miserable. Just tell me what it's going to do to my body. Tell me how it's going to hurt me, and that will help me understand why it's so bad. So there's a little extra tip for you. So non-suicidal self-injury. This is intentional, non-life-threatening bodily harm that they're doing to themselves. And this comes in a variety of different ways. Some of you are probably familiar with a host of different ways. This is not a suicide attempt, and it's important to note that self-injury does not equate to a suicide attempt. Now, it is a risk factor for suicide. So if you have a student who is self-harming, that is a risk factor, and they need to get that help professionally to figure out what's going on under the surface that's causing them to want to
self-harm and mutilate themselves in some way. So it's important to be mindful of that it doesn't automatically mean that they're suicidal, but it is a risk factor. So like it says there, talk to them in a really calm way. Don't be judgmental, okay? So don't start with judgment. Don't kind of pin them in a corner and say, how could you do that, right? Calmly listen to them. Let them know you're trying to just understand. And then for yourself, know that it's not about suicide and that it really is about regulating their emotional feelings. That's what non-suicidal self-injury is all about, is regulating the pain. And we can talk more about that. Elena's going to share about our youth mental health first aid course, and that has a whole section on non-suicidal self-injury, so you can learn more there as well. But just for tonight, know that it does not equal a suicide attempt, but it is a risk factor for suicide. All right, so let's talk about our lesbian, gay, bisexual youth. This study looked at LGBT youth, and as you can see from this chart, they are astonishingly more at risk than other students for these factors. So feeling sad or hopeless, again, for that 2-week period that they've actually pulled away from other activities, they are more than 2 times at risk in terms of what their self-report there is. If they're bullied on school property, they're almost 2 times as high as heterosexual students. They've got a heroin statistic there that they're more likely to use heroin as well. And then of course, what we're talking about here, that's seriously considering attempting suicide. Look at those numbers. If you can't see them, I'll read them to you. 42.8 of the LGB youth, 14.8% of heterosexual youth. So that is about 3 times more likely to be seriously considering suicide, and then attempts is about 4 times as much. So this is a population of youth that is absolutely needing someone to talk to and someone to have those conversations with them, again, in that non-judgmental way where they are able to open up about how they're feeling and what they're experiencing in life. Whether you agree with it or not, they need your ear. They really, really need your ear because they're struggling with a lot internally that's resulting in them seriously considering suicide. So bullying is a very hot topic as well recently, and so let's talk about that. Most students who are involved in bullying are not seriously considering suicide. Most students are not, but it is important to note that if a student is being persistently bullied, it is more likely to lead to things like depression and anxiety and feeling excluded and isolated. But here's the interesting thing to note. Both the bully and the victim are at a higher risk of considering suicide. And what's even more interesting to me is that a bully victim, which is this, that is someone who is a bully in one part of their life, but a victim of bullying in another part of their life. Okay, so that's what a bully victim is. They are at the highest risk for suicidal behavior. So it's those students who are bullying as a result of a lot of the pain that they're experienced by being bullied. Okay, and so they're the ones in our midst that are at the highest risk. And so some of these kids are the hardest to really have these conversations with because they may come across as this very tough exterior that they don't really want to talk to you, and especially if they're getting in trouble for bullying, that may be something that they really are like, I don't really want to talk to you about this, I'm in trouble. Well, there may be something going on under the surface there that makes them this bully victim. And then of course it's important to note that all kids are impacted by bullying, even if they're not directly involved. If they see it or they hear of it, it still impacts them. So a precipitating event is another situation in which it does link to suicide, and that would be something that in a person's life, something has triggered. Something has triggered them. Something is causing them to think about taking their own life because of this event. That can be something like a breakup, right? Because in adolescence, the relationships are everything to them, right? And so it can be something like a breakup. It could be something that happened at home. It could be a bullying incident. It could be something like failing a test, right? So there's no real measure for how severe it has to be, but it can be a precipitating event. Now it's important to note, like it says here on that slide, that no single event causes a suicide. No single event does. It's a series of risk factors that have all added up within someone that are causing them to consider that. So it's never one thing, but precipitating events can certainly have an influence. So warning signs, right? So you're here because you want to understand suicide with youth and what's going on, and so you want some tangible warning signs. What do I need to look for in my kiddo to know whether or not they are considering suicide or struggling with depression? The truth is that most people display warning signs before suicide, before an attempt. Most people do display signs. Now, having said that, you may not be the one. You may think that you should have been the one to see them, but you may not have been the one who saw those warning signs. And that's okay. And we're going to talk about that a little bit later as well, that there's no fault put on anyone when there is a suicide. So let's talk about these warning signs. They are, by definition, an indication that an individual may be experiencing depression or thoughts of suicide. Okay, so these are things that will be that flag for you that make you kind of think, okay, something's going on there. It's important that you find immediate help if they're talking about death or they're talking about suicide specifically. Find them medical help right away if they're talking about that. Expressing hopelessness about the future, if they're just saying, oh, it doesn't really matter because I probably won't be going to college, or I'm probably not going to make it there. If they're talking about things that just sound like they're really hopeless about the future, making sure that you're talking with them and talking through that process. What makes you feel that way? What makes you think that way? Have that conversation with them. If they are in a season of overwhelming pain or distress emotionally, if again there's been a precipitating event, or maybe they're just in a really stressful time period, making sure that you're paying attention to how they're acting, how they're feeling. And then of course, if they've got any kind of withdrawal from things socially, if they're not hanging out with their friends anymore, if they're isolating themselves, if they usually so enjoyed playing basketball and now they don't want to play basketball, these are reasons or the signs that you should pay attention to, that there might be something going on there. If you're seeing an increase or a decrease in their sleep, if they're sleeping a lot or if they're sleeping very little, that would be something to pay attention to and see as a flag. If you're seeing them act out in anger or hostility that's not normal for them, that would be a warning sign. And like it says at the bottom here, this is really it. You know your kids better than anyone. So if you are seeing a significant change or difference in how they're acting, how they're behaving, who they're hanging out with, what their interests are, if something has drastically changed for the worse, that is your warning sign. That's when you know that a conversation needs to happen and the potential for them to get linked to a professional for some help. This is meant to demonstrate to you that there are a lot of facets to this suicide problem. For those of you who can't read the smaller text, suicide is in the middle, and then you've got neurobiology, impulsiveness, hopelessness, family history, psychodynamic, vulnerability, suicidal, life stressors, access to weapons, severe medical illness, substance use, personality disorder and traits, and psychiatric illness comorbidity. So these are all things that can contribute to suicide. So I keep hammering this home, I know, but it's important to just remember that there are so many different factors that play into suicide, and it's important that we are aware of them, which is what tonight is all about, to make you aware of them so that we can have these conversations with youth. So what do you do? Right, so you're starting to see warning signs. You want to know what you should do. Talk with them about how they're feeling. Offer them empathy. You may not get it. You may not understand why they're feeling the way they're feeling. From your perspective, it may just be the silliest thing in the world, but they're feeling it. So feel it with them. Be there with them in an empathetic way. And then ask them the question. If you are really seeing some signs that you think the question needs to be asked, do not hesitate to ask them, are you thinking of killing yourself, or are you considering suicide? And a lot of people get turned off by that question, because that question is bold and it is very pointed and it brings that topic of suicide up. But it has to be asked, because again, you're not planting that idea in their head, and you want to give them the space to be able to say yes or yeah. And you may need to ask it more than once. You may need to ask it 2 or 3 times, either in one setting or over the course of multiple settings, but I'm just urging you to not be afraid to ask that question, because that question could save a life. It could save their life. And then, as I mentioned earlier, the follow-up question to that, if they say yes, is, do you have a plan? Or do you know how you will do it? And talk with them through that and understand, maybe whether or not that's an emergency situation. If they have means directly available to them, then that's something you want to stay with them until that crisis is resolved. Don't leave them to go get the car or, just stay by their side, be with them. But on top of that, if it's not an emergency situation and maybe their plan is not the most put together plan, still talk to them about getting some help and talking to a professional or sitting and having the conversation with them. Figure out a way that you guys can address this issue together as the trusted adult in their life. And then I put up here a suicide hotline number that can be called by anyone to talk with a counselor 24/7. And so for those of you who can't read it, it's 800-273-TALK, which is 8255. That's 800-273-TALK. And then there's also a text line available to youth. It's only from 3 p.m. to midnight every day. So they're shooting for that after school time period, right, when kids might be home alone and struggling with some of these thoughts. And that number is 855-449-1212. And that is just a text line. I don't think you can call that number. You can't call that number. You just text it. So again, that's 855-449-1212. And so these numbers, having those on hand, I have them saved in my phone so that if I'm ever working with a youth that is talking to me about some things, I can say, you know what, I don't feel like I'm fully equipped to talk to you about this. Would you mind if we maybe just called and talked to someone together about it? Would that be okay? Yeah, sure, let's talk, right? So I've got that number in my phone. So I'd encourage you guys, save these numbers, hand them out to the youth in your life, and be able to offer them some resources if they are having some struggles. It's also important that as a community and individually, we are working to build those protective factors. So earlier I talked about risk factors and how these are things that may cause a problem, make a problem more likely in an individual. Protective factors protect them from that issue. So protective factors would keep them, would reduce that risk and keep them protected from potential suicidal ideation. Again, just like risk factors are not causes, protective factors are not immunity, right? It doesn't mean that they automatically will not attempt or consider. However, it does reduce that risk. So these are things within a student or within a child, if they're more adaptable by temperament, right? They're kind of easygoing, they go with the flow, or they have good self-esteem, or even spiritual faith of some sort. That's a protective factor. Within their family, if they feel connected in their family, or they feel supported in their social networks, right? So those are things that protect them. If they have restricted access to means, okay? So if you happen to have firearms in your home, keep those locked up, so that you are building a protective factor by not allowing them to have access. Same thing with pills in your pill cabinet. Keep those locked up so that they can't access those pills for overdose or just for misuse in general. And then of course at the school, that they're having a positive experience and they feel connected in their school environment. And they've got friends there, they've got adults there that they can rely on. So these are some protective factors that we as a community can make sure that we are enhancing and building. And then universally, this is something that's meant to impact the entire population. That's what I mean by universal strategies of prevention here. And so these are things that might be provided to a whole school or to a whole population. One example that we have of this is we developed an app. It's called the Ponya app, P-O-N-Y-A. So if you search for that on either your Android or your Apple app store, search Ponya Mental Health. If you just search Ponya, you're going to get some My Little Pony games. But Ponya Mental Health, and that's a universal strategy. It's something that's available to the entire public, but it allows youth to download this app, and there's a panda bear, and you put your feelings into the panda bear. So you say, oh, I feel tired, or I feel like my stomach hurts, or I feel like there's a heavy cloud over me, and you put in all these feelings into a panda bear, and that panda basically helps to generate resources for you based on how you're feeling. So that might be a YouTube video about someone who has figured out a way that she copes with her anxiety. Or it could be an article that takes you to education about depression and some self-help strategies like doodling or journaling and things that might help. So we actually have over on our table some cards that have the Panya app written on it. So if you forget that or whatever, you can take one of those cards home and download the app, check it out. We think it's really, really neat. And there's local resources and national resources in that app. And we're going to kind of try to make it, we're going to expand it over the next year and make it even cooler. But I got it approved by some students here in Springfield Public Schools. They think it's pretty cool. So we feel all right about it. So these universal prevention strategies really help reach all of the youth. So even if my youth that I know and I work with, they may not have a struggle with a mental illness, but they've downloaded it so that they can share it with their peer if their peer is sharing that they have some issues or that they're trying to work through something. So this is a strategy that's available to everybody, and it helps reduce stigma, right? So it's like, hey, I got the Panya app. Do you have the Panya app? Yeah, we should all have the Panya app, right? So it helps reduce that stigma. It's not stigmatizing to have this app on your phone. It's something that everybody's doing. And so it just helps these universal prevention strategies really help to get the community behind this kind of work and preventing youth suicide. So my last slide here, I want to thank you guys, first of all, for being so involved and interested in this topic. Whether you have a personal reason for being here or a work reason for being here, you're here, and that matters, and I want to thank you for that. And then of course, by being here, you are a part of reducing stigma. You are a part of making a difference in this community to say, hey, we're going to start being there for youth to the nth degree so that they are never in want of a trusted adult. We're going to create little bubbles around all of our youth, right? So they've got all of these adults that are around them to help them and to be there for them and who know how to have that conversation. So what we're going to move into now is I will have our panelists come up. We have a great panel to share with you guys tonight. The first one that I have is for you, Paul. So there's been a lot of discussion nationally about this show, 13 Reasons Why, and you recently interviewed with the media kind of about that show and maybe some of the effects that it has. So can you talk with us about how that show may provide youth with a misinterpretation about suicide?
Sure thing, I'd be happy to. So I'm curious, how many of you have seen at least some of that? And how many have maybe kids who have seen it? Yeah. So I watched all 13 hours of it one weekend, a couple of days after I learned that my 14-year-old son was halfway through it, and when I learned what it was about. So, it's one of the perils of having a psychologist father who's a psychological autopsy investigator and suicide reviewers. So I watched the entire thing, and as in all things, there are some good things and some bad things about it. But I came away from it with on balance, my opinion being that it's really, really a destructive force, and that I wish my son hadn't seen it, but that's the reason I watched it, so I could talk to him about it at least. So that's the bottom line for me, is if you have a child who's seen it or is watching it, make sure you're there to talk to them. There's all those skills that you just learned about, and make sure that you talk through all those feelings and concerns that are most definitely going to be there, and help them surface the ones that aren't quite ready to be talked about yet, to the extent that you can. So on balance, though, it does have some good things. It does portray a few things realistically. It does definitely put an exclamation point on the fact that we talked about bullying and so forth, and it does put an exclamation point on that. Are we doing questions? Right, like how could you think that would have some effect on you?
So my question is, how do I approach that subject in a way that gets her to talk about
you want me to tell you how to get a 14-year-old to talk about something they don't want to talk about? Money, cars, promises of trips. It's really tough, but honestly, my son didn't want to talk about it either. And after I watched it, I kind of insisted on him talking a little bit at least, sort of monosyllabic replies. So I did most of the talking. So you understand that there's a really misperception portrayed in that show, and you just keep giving him stimuli, give him something to respond to, and eventually, hopefully, she'll open up to you. He did a little bit, but really, he had the similar response. They would get along well because he was like, Dad, I get it, okay? I'm fine. It didn't have any effect on me. I know it's just fiction in Hollywood and da. I was like, I know, buddy, but I just want I'll make sure, that you understand it was her decision in that fictional story to take her life. And all this idea, of course, the 13 reasons why, if you haven't seen it, are all other people. And that is a powerful message. In fact, my very favorite theory and model of suicide and why people die by suicide is by Tom Joyner. It's called the interpersonal model of suicide. And it's so called because it really is, the desire to die by suicide is really almost always rooted in interpersonal relationships of one kind or another, or the lack thereof. And the lack of belonging and a sense of burdensomeness. That is all about interpersonal relationships. So anyway, I didn't fully answer your question. I probably don't have a gold standard answer for you, other than don't give up. Keep talking until you're satisfied that that she really has said everything she has to say. But again, to kind of finish up with this question, of course, if you've seen it, I hope you can see how very unrealistic it is about how the aftermath of suicide plays out. A dear friend who just lost her son to suicide, and trust me, none of that stuff in the Netflix special series is happening in their lives. You don't get to live beyond your death by suicide in a glorified, exalted state. When you die by suicide, you leave a trail of wreckage that is incomprehensible to folks who haven't experienced it. So it most certainly portrays that in a way that is just, to me, irresponsible. And I know art, and I'm not a censor or whatever, but I believe, and I'm glad they've added the warnings now about it and so forth. But, and it's an imperfect analogy, but I like it. And when, we're in truly a public health epidemic of suicide, we have more people dying by suicide than we do by motor vehicle accidents. And to me, I liken it to, just playing fast and loose back at the height of the AIDS epidemic, just putting out some stuff for youth to talk about, that glorifies unprotected sex and IV drug use. If it can tip the balance for a kid, who's already struggling, then, to me, it's just, it's not worth they don't have tape anymore, whatever it's printed on. It's on balance a very destructive thing, in my opinion, and that's not to say that it doesn't have some good messages too.
Thank you. And I'll also note over on our resource table, we do have a sheet. It's the front one of that stand-up. It is discussion and talking points about 13 reasons why for parents. So it's not, again, a gold standard or a script, but at least it has a lot of bullet points on there that will just help you think through how to have that conversation, how to approach it, things to say, points to make that would be good to at least let them know that you feel that way. And so that's available to all of you as well. I think I'm going to jump to our two school counselors, Callie and Janine. You guys see students every week, and you guys have your ear with what's going on with them. Can you both share a little about what you're seeing in your counselor role, and maybe what students are talking about or saying about mental illness and suicide?
I liken adolescents to 2- and 3-year-olds. They live in the moment. So whatever is happening at that time, that is what is important to them, and that's what they're going to be talking about with their friends, with their peers, and with us sometimes. So I think after we had, sadly, the 2 suicides in our community, it was a talking point. And whether you were in my office or not, it was something that I asked about. Have you seen the movie? What are your reactions? And I heard lots of different reactions from that. So do we get students reporting about other students talking about suicide from time to time? Yes, we do. I don't think they talk about it to adults as much as they talked about it to each other, or they talk about it in social media. I wish they were talking to adults more than they do. But as all you said with the research, they're not talking to them about it isn't going to put the ideas in their heads. So anyway, I think the newspaper or the news is a great segue as a parent to have conversations. Hey, I saw this news story. Hey, I read this in the paper. This is what it said. What do you think? And then listen. If I, as a parent of a 19 and a 21-year-old, what I've learned more from your children is to listen without judging, but just throw some stuff out and really listen to what they have to say.
I would say similar, and most of the kids that I have in my office around this topic, usually a teacher brings something they've written, another student, a friend will come in and share what they have said. Very rarely is it the actual student walking in of their own volition. So I would say for your kids too, to just teach them that it's okay to tell, right? It's okay to quote unquote tell on their friends and to bring that information to light. 99% of the time when I get the student finally in my office, they are thrilled to be able to talk with somebody about it. Absolutely thrilled, and it comes gushing out. I don't have to press very hard. They're wanting to talk about it, they're needing to talk about it. I will say I've had several teachers as well in my office the past few weeks saying this is being brought up in class discussions. The kids are wanting and needing a place to be able to have these kind of discussions, and facilitated, right, by some adults that kind of have their own emotions in check. So I would just encourage you as parents, keep pushing that, keep plugging away. I know sometimes you get the cold shoulder from them. I will say use your school counselors. I've had parents call and say, would you mind checking on, but don't tell them that I called. We can swing that, absolutely.
Elena, I'm going to bump to you. The question that I have for you is that your role with Community Partnership is to facilitate a community response to youth drug use and mental health challenges, which of course includes suicide. What can a community member do in response to a youth suicide or in working with that youth considering suicide?
So my role is facilitating the youth mental health first aid trainings and coordinating that program. And in that, I talk with parents and community members about how to identify signs and symptoms of mental health challenges and how to go in and have a conversation, how to listen non-judgmentally, how to give them resources and information so that those youth are able to reach out. And I guess that's what my biggest push here tonight is, that by having those conversations, by listening to what they have to say, by finding out the local resources that are around here. We have a lot of resources, finding out self-help strategies, and really empowering the youth to access that. I think we can really make a difference as a community.
Thank you. And I'm going to ask Rhonda a question, but if you've written any questions down, please hold those up in the air, and Chris is going to come around and get those. Okay, so Rhonda, last but certainly not least, could you share with us how Springfield Public Schools responds to a youth who's maybe attempting suicide or considering that, or have within that school district? So kind of what is Springfield Public Schools' response?
We do have a district procedure that is available to all counselors and administrators that kind of outlines what steps we need to take depending on whether the attempt is something that happened outside of school or within the school setting. Also, if a student is talking about it, there are several different steps that any adult that's working with that student, whether it be the school counselor, a teacher, a nurse, but we do initially want that student to be able to talk to the school counselor. So if a teacher becomes aware or another student becomes aware that a friend of theirs is considering suicide, then we call for that student. The counselor has a conversation with the student. And there is a lethality assessment that is called, that a series of questions that student is asked by the counselor or other adult in the building that is using that screening instrument to determine if this is a very urgent situation. But no matter how urgent it may be, we want the parent to be notified. And that's the first step after that conversation is they get on the phone, they contact the parent. If the student has, for instance, taken some pills or some kind of medication and there's signs that they may be under the influence or maybe have an overdose at school and needs medical attention, then of course that is addressed immediately also. But the key is to notify parents, to give them resources of where to follow up with some more professional attention, to get an evaluation, thorough evaluation, and hopefully, they will be able to identify how serious this is and if the student may possibly need some inpatient treatment or if they need outpatient. But either way, we want the parents to be involved immediately or the legal guardian of that student. So our process is to make sure that you all get the first call on that.
Thank you. All right, we've got questions rolling in. First one I'm going to ask our panelists, and whoever has their hand up first gets the mic. Do you feel that we are doing a better job of interventions compared to 5 or 10 years ago, even though our numbers are increasing in teen suicides? So to reword that, maybe in a little better way, we're seeing a rise in teen suicides, but are we using better interventions than we were 5 or 10 years ago, despite the fact that we're seeing more attempts?
What? So it's a tough question, really, because we definitely are continuously, one of the two Healthy People 2020 indicators is going in the wrong direction, of course, is teen suicide. So the rates are going up, but yeah, sort of counterintuitively, we do have actually better interventions now. We actually have evidence-based, interventions specifically targeting suicidality. We used to have this idea, and Ricky, you kind of spoke to that a bit about, the correlation between depression and suicidality. But, we used to have this idea, well, you treat the depression, you treat the mental illness, and the suicidality goes away. That's just not the case. So we do have better interventions. We're engaged, at Burrell, we're engaged, along with all other community mental health centers in the state, in what's called the zero suicide movement, the zero suicide approach. Which sets as its goal 0 suicides, and it's been proven to work, actually. Where it was developed, Henry Ford Health System up in Detroit, they actually did achieve 0 suicides in a 300,000 member health plan for 2 years in a row, and generally the rates have gone way down. So we do have better interventions, and what it takes, though, what the reason that when you look at it as a microcosm, the way they were able to get to those 0 rates and to drastically lower the rates of suicide is, and what I think of as an all-hands-on-deck approach, which is everybody in the entire organization. I'm thinking about health systems and behavioral health systems, but it could apply to schools and any other sort of community organizations, that everybody is trained to look for suicidal thoughts. Everybody's trained every single time that they come in, especially for health or behavioral health care, to assess for suicidality. And everybody's, from the receptionist to the janitors to the maintenance people, are all given training and awareness raising about it. And that's what it takes, as well as having, of course, a care path for treating that suicidality. And it involves a big dose of means restriction, which is actually one of the best ways to prevent suicide, because there's this sort of fatalism implied in the idea that, well, you can do means restriction, meaning take away the gun, take away the knife, take away the pills, but they're just going to get some more anyway. But you know what? They don't. A lot of times they don't. You take it away from them, the window passes, they get some help, the frame of mind changes, and it saves lives. That most basic of interventions of means restriction. And we have to get a lot more comfortable with that. Which is not to say once you do that you give up and you stop being vigilant, but again, that idea is very powerful and it's been shown to work. That's one of the reasons why 0 suicide approaches work so well. And it involves that plus a care path specifically oriented towards suicidal thought, those tormented ideations, as they say.
Anyone else? next question is a great one. So when you are talking with a youth who may be considering suicide and has told you that, is it okay to say, everybody thinks about suicide from time to time? And then maybe point out that it's when you start forming a plan that it becomes concerning. So does that help take away the stigma? Does it minimize the threat? Is that response a good one?
I maybe wouldn't use the word everybody, but it's okay to tell them that it's common, because that is true. That those are common thoughts among teens to help reduce that stigma. So yes, I think that's okay. Kind of those broad generalizations, everybody and nobody, we try to stay away from most of the time. What was the second part of that?
If pointing out that it's when a plan forms that's the most concerning part. Can you share that?
You can ask them about a plan. You guys can, I think everybody has a little bit different approach. You have to feel what feels comfortable for you, right? And so this is what I tell my teachers too. If you don't feel comfortable having the conversation, it's okay to pass them to somebody that is, or to go with them. All of that is okay. I try to, anything they tell me is not shocking, right? Well, I've heard that a million times before, so taking the shock value or factor out of what they're sharing with you. So it's okay to tell them, I'm concerned with what you're saying, but oh my gosh, you have a plan. We have to, downplay all of that kind of thing. That this is normal conversation, and I like to get real low and slow, right? Calming your own self down. I don't know if I answered that or not, but
I think you did. Okay. Do you have anything to add? Okay. There are two questions that came in that were very similar, so I want to throw those out there. So if a teen is considering suicide, or your child is, and they're asked the question if they're having thoughts of killing themselves, one, will they lie? And two, basically, will they lie? Do they usually answer yes, no? How honest will they be when you ask them that question?
I can only speak to my experience, but I feel like kids are very honest. When you're having those conversations, they're going to be honest with you. If they're thinking about it, they're going to tell you yes, they are. If they're not, they're going to tell you no. Or one of the answers I get is, I'm not thinking about right now, but last year I did, or a couple of months ago I was. But I will tell you, even if they tell me I'm not thinking about it right now, or I'm not, the conversation does go further than that. We just don't go, oh, okay, go back to class. I will tell you that 13 reasons that counselor made me sick to my stomach when she didn't talk to him and he sent her off to class. We don't do that. I would tell you, even if a student tells me that don't have a plan, I still call the parent and say, I was talking to your student today, someone reported, and we're concerned. So we talk to you anyway. But I feel like students, it's a serious matter and they know it. And we talk about people care about you, and that's why it's been reported to my office, and nobody can be cared about too much. And I think they're honest.
Thank you. So we mentioned earlier about the teen text line. So the question is, what would a teen expect when they text that? I don't know if you guys have had experience sending youth to that text line, but what will be their experience, or what's the best way to guide them towards that and encourage them to not be afraid to call or text?
So there are actually a couple of text lines. There's the text line that we provided here, and then there's a national text line as well. It's 741-741. And when they text that, there are trained professionals on the receiving end to be able to text back immediately and respond and have a conversation with that person back and forth. So they're going to ask pointed questions. They're going to follow up with responses. They are specifically trained on how to engage in that conversation. So they should expect that they're going to have a trained professional talking with them and having a conversation with them through text.
Great. Thank you. Next question is pretty simple. How young is too young to start talking about suicide? It stumped them.
That's hard to, a kid, obviously a child as young as a couple of years old will know if somebody's missing. But it really is just trying to sort of evaluate developmental appropriateness. You get up to around 7, 8, 9, 10 years of age, I'd be, very careful about how to talk about how I talked about it with them. Be factual, but mostly focus on their feelings about what happened. And begin to use words, that sort of express the extreme level of despair and sadness. Begin to, at that age, they can start to understand that they were so sad that they just didn't want to live anymore. But again, that's kind of, your kid, what they're going to be ready for. Usually by age, about middle school or high school, certainly, a full description of the event that might have happened or whatever. Now I'm thinking specifically about, a completed suicide, but I think, you can certainly start those conversations very early about, obviously mental health and mental health promotion, which is suicide prevention in my view. So. Any developmental psychologists on the panel want to speak to that? Because it's a hard question, and it really does just go to knowing your kid and knowing and being able to kind of read them as you're talking about it, and certainly be there to follow up.
So I mentioned in my presentation that Springfield Public Schools had a plan to implement the Signs of Suicide youth training. So I had a question come in that asked about what that plan was. So Rhonda, could you answer that for us?
Sure. Beginning with next school year, we are going to implement the Signs of Suicide youth curriculum, or the model, within our 9th grade health classes. So every student that takes health, which is a required class for graduation, will have a 3-lesson series on this best practice model curriculum. It will be co-taught by the health teacher and the counselor. So they will have the opportunity to learn some of the information that was shared tonight in the Trusted Adult Training. They also will learn a process called ACT, A-C-T, and that will teach them some strategies to help their friends if they need assistance in identifying resources for their friends if they have a friend that's in distress or talking about dying by suicide. The other components of that program, there is a parent information component. We hope to work this summer on identifying how we are going to share information with parents about what their students are studying, and then also we will be doing some more work with staff in the Trusted Adult Training and suicide awareness. So we hope to build all of that into some of our other professional learning opportunities that we have for all school staff. And then as well, we're going to start at the middle school. There's a middle school model also. That will be facilitated by the school counselors. It's not going to be implemented within a specific class, but they will have the same opportunity to deliver that information to middle school students. Yes?
Mention that so many of the speakers that the students will get to see, some of the special professionals that come in, they're the ones who really, like someone who's lived it and been there, done that. So if you can bring someone in like that, I think that would really hit home with the kids. I know there's been some other speakers that are coming into high schools, and they're like, wow, mom, this really, it hits home more instead of just being taught the same curriculum over and over. They need to see real life. And I think that would be really helpful because that's happening here in Springfield.
Yes, that's correct. We do have opportunities for teachers to bring in outside presenters on certain topics. There has always been a component in the health class that deals with mental health, and so depending on their teacher, and they sometimes will bring in outside professionals or people that have experienced it. So you're correct. We do bring that in.
Thank you. And if you haven't been through our youth mental health first aid training, and
number one, I highly recommend it. It is a day out of your life, but it is a day well worth it. It's a fantastic training that you walk away with a inch-thick manual on mental illness in youth and how to respond specifically to different situations. And in that training is a young man. His name is Kevin Hines, and he is one of the few remaining survivors of a Golden Gate Bridge jump in San Francisco. And he tells his story on video in that training, and he now spends his life touring and speaking. He has that lived experience. So for those of you who didn't hear, she was asking, if maybe the schools can think about bringing someone in with lived experience, to help kind of the kids see someone. And so as a part of the project that Elena coordinates, we're working on bringing Kevin Hines in for September of 2018, and we'll likely be having him do a community meeting. And so we'll be putting a lot of publicity out for that, because my goal is to pack JQH, just so everyone knows. But he has a powerful, powerful message where he talks about his attempt at suicide, but he also really provides a lot of hope in recovery and walking away from those situations. And so we'll be really thrilled to bring him in. I've had the honor to meet him twice, and he is just this ball of energy and a really great advocate for mental health. And so on that, so be looking for that. I know that feels like it's forever away, but September 2018 is going to be tomorrow. So be looking for that. It will be a really great night to hear a story of someone who has that lived experience, and we'll be sharing that. Okay, back to the questions. So we've been offering everybody some ideas and that they need to have a conversation with their youth. But in the event that the youth is not showing warning signs, you're not seeing anything, you just want to talk about suicide because you came to A Million Reasons Why and they told me to have conversations with my student about suicide. How do I bring that up in a casual way? What are some very tangible starter conversations? I mean, do you just say, I want to talk to you about suicide? Or like what are some tangible ways?
Both counselors.
I think you have an in right now just with what's been going on in the community. So it's an easy in. I always feel like media is an easy in, and it's what's happening right now with the 13 reasons and continues to happen. I saw something on the news just before I came over here. 7 kids this year in one district in Colorado, and they're citing the 13 reasons why. So a news clip, anything, it's not hard to find something to be able to kind of bring up the conversation besides, I want to know exactly what you're thinking right this second. But I feel like being where they're at, so Facebook and Twitter and all of those things, that you're seeing what kids are posting, it's happening. It's easy for me, at least, to think you've got an in right now in that way.
Well, as a parent, the best conversations were held in the car. They're not feeling like they're grilled because there's not that eye contact. You're driving down the road, plus they can't hop out of the car, so they've got to listen to you. And you know, just, hey, I was at this thing today, and this is what some of the things they were saying. What do you think about that? And then listen, and then kind of respond to that. So, like I said, cars are some of the best places to have conversations.
Yeah. Great, thank you. Okay, so we have listed the schools as a pretty big resource, but in the event that the schools are inaccessible for whatever reason, or maybe that there's just kind of a bad relationship between a family and a school, what are some other places in a community that parents can maybe go if they're concerned about their child?
I'm shamelessly plugging the Youth Mental Health First Aid training right now, but if you attend, we give you a very extensive list of resources here in Greene County specifically. You can actually access this list of resources online too, so I really want you to attend. But if you cannot, if you go to our website at cpozarks.org/YMHSP, Youth Mental Health Support Project. We have an extensive list on there of the local resources in Greene County. And then through that Panya app, that's a way that youth can actually access those exact resources that we vetted and made sure that are safe for them to look at and to utilize and to reach out to. So those are my big ones.
And of course, borough behavioral health plays, in my opinion. So, but I wanted to actually back up a little bit. Chris, I didn't put a fine point on it when I was talking about 13 reasons, as we kind of talked about. He primed the pump a little bit, which is a phrase that Donald Trump made up, by the way. I don't know if you heard it. It's true. He made that up. But it has to do with this idea of being a survivor of suicide attempt, or a survivor of the loss of a loved one to suicide, and the guilt and the unbelievable guilt and self-blame that can happen after that. And of course, there's a duality here. Life is weird and complicated and turned in upon itself. But one of the messages of that show, one of Kevin Hines' messages, for example, he was talking about when he was on the bus to jump off the Golden Gate Bridge, and he made up his mind to do that. But if just one person said, "Hey, how you doing?" that he decided he would not. So in some sense, of course, it's like, am I my brother's keeper? Yes, we all need to be involved in the life-saving mission. But ultimately, the person who dies by suicide is responsible for that act. And as hard as it is, and as long as it sometimes takes for people, that's really the message that survivors need to learn. And I know that it's like water off a duck's back to people who have who have really lost someone, and they know they could have done more. They sometimes they never get over that. And that's really tough. And actually, speaking of songs, I wrote a song because I saw a post on Facebook a few months ago that was about a woman who had lost a friend to suicide. And she said, "I just couldn't believe it." This is often the response. She had everything, vivaciousness and beauty and brains and funny, and she basically said, "I couldn't get across those two little words that can make all the difference, which is you matter. You matter to me, you matter to this world, you matter." And that's really a whole way of encapsulating the message of that song, but also the interpersonal theory of suicide. When you make somebody feel like they matter, you have already sort of neutralized two of the biggest risk factors for suicidal thought. So anyway, just wanted to put a finer point on some of that.
Sorry, I'm hijacking this again. He just segued me into, I want to talk with you guys for a really quick second about another way that you can get involved. So he was talking about survivors of suicide loss, and actually we have a coalition here in Southwest Missouri. We service Greene County and Christian County, and our goal is no more suicides. And the two co-chairs of that coalition are right here. That is Tish Creason and Kim Hale. They have information up here at the table, but we actually host a Survivors of Suicide Loss Day so that we can support the community members who have lost a loved one. We give out information for survivors group at NAMI, and it's just a way to really get involved and help impact the community to reduce suicide. So if you have any questions about that, they are here to answer any of those questions, or you can holler at me.
Thank you. So here's a question. Do violent video games make a child more susceptible to suicide?
I don't know about more susceptible to suicide. I know in the Too Good for Violence, which is a curriculum that counselors use in Springfield Public Schools, it says that when we're watching violence, whether it's real that you need to see in front of us, or whether it's through media or whatever, the three effects are, it does cause us to be more violent, it causes us to be less helpful, and it causes us to be more afraid. So when we talk about our middle school students, I used to be a middle school counselor before I went to high school, as we talk about, I'm not going to stop my own son when he was, and now even as a 19-year-old, from playing video games. But when that blood spats up on the screen, I say to him, that person had a family. That person, in real life, that person's not going to get back up. Let's remember that that's pretend, let's remember that. I haven't seen statistics on violence in video games with suicide, but I have seen that statistic, and I do want you to know that we're talking to our students about that part of it. Yes, violence causes us to be more afraid, less helpful, and sometimes more violent. And you know, you think about when kids are watching cartoons. After they watch the cartoons, what do they do? If it's a violent one.
The research on that really is, I mean, there is most of the systematic reviews show a very small effect. But what I'm concerned about with those ultra-realistic, hyper-violent games is it plays into the third component of that model I was talking about, which is basically, there's two things that predict the desire to die by suicide. That's lack of belonging and sense of burdensomeness. But lots of people have that and never die by suicide. But the ability to die by suicide is caused by repeated exposure to traumatic events. For example, that's why we have higher rates among combat veterans and so forth, first responders. Repeated exposure to violent events, to traumatic events and so forth. So it's basically a habituation effect, desensitization. So to the extent that there's any evidence that it can desensitize folks to that and make it in some way get over that sort of love of life, biophilic response as they call it, then it could be very harmful. So especially if you have a depressive child, I'd be careful about it.
If a youth has a friend that they're concerned about, how should a youth start a conversation with that friend that's considering suicide at the time?
I think just continuing to tell your kids that it is okay to tell, right? That some secrets are not good to keep, and it really depends on the kid. I've had some students come in and say, "This is what my friend shared. Please don't tell them I told you." Great, we will keep that confidence for them. If they feel that that's what they need to do to tell, that's an option. I've had kids actually walk the student down with them. That's an option as well. Hey, I see that you're feeling down. I will say a lot of times the student doesn't even have to start the conversation. Usually what happens is these kids are sharing with their friends through text and through Facebook and through media. They're sharing these things openly with their friends. And so the conversation has already started. I'm just gonna tell you it's happening already with the friend groups. So just kind of teaching your kids how to find them an avenue for help. And there's a million different ways to do that. If they want to walk them down to the office, great. If they want to come and share what they know and never have to talk about it again, great. Those conversations are already happening. That's the biggest thing I would say. Do you want to answer that?
Yeah, I need a number.
We have had through the years various hotline opportunities and found for a number of things. That's one of them. School violence hotline is a statewide hotline, but we also, when I first came to the district, there was a hotline that students or anyone could call to give information where they felt somebody might be in trouble. However, it was not utilized at all. I mean, really very seldom, and when it was utilized, it was not used appropriately. And promoted, yeah, I mean, the numbers were posted, it was on various, posters and ways, and so I don't know promoted where a lot of them, quite honestly, I don't remember all the details about how we did promote it, but it was available to them if they wanted to use it. We could certainly consider that. That's a discussion that we could have again to see if that's a possibility.
Even if it helps one kid, I mean,
Well, absolutely, you know,
I'd
one,
rather, I mean, even if there's prank calls and texts.
I've had students have their parents call. And so the parent says, I'm anonymous, and they are because I don't know who they are, but my daughter was talking to me about so-and-so. I can't even tell you whether that student is in my building, but I'm willing to listen to you. I won't say, yes, the student goes to the school or not, because I don't know who I'm talking to. But if someone calls any one of us and you're concerned about a student, we're going to listen and we're going to do what we feel is appropriate. So I have had students, I'm sure, do that. True. But I've had students email sometimes, I've had a student email before, but then I knew who it was, but. All right.
So the signs of suicide training that will be offered here in Springfield Public Schools to the students teaches students acronym ACT, Acknowledge, Care, Tell. And so the whole idea is that they acknowledge that they're seeing signs because they learn the signs, similar to what you guys did tonight. They learn them through videos and vignettes and that kind of thing, but they learn the signs, so they acknowledge when they're seeing them. They tell their friends that they care about what they're feeling and what they're going through, and then they tell a trusted adult. So that either looks like, hey, like they were saying, come with me, we'll go to the counselor together, or I'm going to the counselor on behalf of my friends because I'm really concerned about them. So if all of these students are learning that acronym, we hope to see an increase in students who are willing to go and talk to counselors together about a peer or with a peer, and so that there is kind of more communication happening on that front. Just so you know, so for the original question of what to say, what a youth should say to their peers, a great way to do it is acknowledge what you're seeing and that it's a risk. Tell them that you care about them. Have that conversation with them, that you really want them to be okay, and that you think that you should go and talk to an adult. So. Question that came through too, actually, that were very similar. So let's say that the school calls a parent because they have seen warning signs. They think that the youth is experiencing some consideration of suicide, but maybe the parent or guardian does not react in a way that is necessary. What happens next? Is that a hotline call, or what do you guys choose to do next?
do you want to? Who wants to take that one?
Yes. The chain of events kind of goes to make the phone call, have conversation with parents. What's your plan for, next steps? And then the parent or someone on the child's guardian list is actually coming to pick the kid up. So we are literally handing them over to you. Hotline calls that I have made, the parent has refused to get the child help or has refused to come pick them up from school. Those are the two that I have made personally. So the answer is yes, that we are mandated reporters, and if we feel that there's neglect in any way, we are legally obligated to make that phone call.
Yeah.
Okay.
And related to that, how do you handle as counselors if potentially the home life is the precipitating event or situation that might be causing the child to feel suicidal? How is that handled?
Sometimes there's information shared during the conversation that the student and counselor are having. There may be information shared that's not related to the student's desire to die. It may be something that is shared with the counselor about what's going on at home that would be a hotlineable situation. That might not be neglect on the part of the parent. It may actually be an abuse situation. When you say, their environment, their living environment, if it's something to do with their relationships with their parents, if they're just fighting or having a problem with the parent and how they discipline them and they're angry about it and they're upset about it, it's always very difficult sometimes to determine unless you get some specific information, if you have a gut feeling that there's something going on that needs to be hotlined, then obviously the counselor's going to do it. But there may be a situation, and sometimes that does happen. They will hotline a situation when it doesn't really directly relate to the student sharing that they are suicidal. I don't know if that makes sense or not, but it could possibly end up that way. Does that answer the question for whoever asked it? Thank you.
Thanks. So I've got a part 1 and a part 2 question. So part 1 would be, what do you do if you are seeing the warning signs, but your child keeps saying, no, I'm not considering suicide, no, that's not an option for me? What are your next steps as a parent? So that's part 1 to the question.
So I guess at that point, what I would suggest is getting the rest of the support system involved. So if that is school counselors, that's teachers, if that's youth pastors, if that's a coach, if that is aunts, uncles, cousins, whoever the rest of that support system is, getting them involved and helping the youth see that they have other trusted adults in their life that they can talk to about this event. I think having a community approach and having all hands on deck, as Paul said earlier, is going to be the best way to really show a youth that they have multiple resources to reach out to. There are multiple people in their life that they can turn to for this. If there's not another trusted adult, then giving them those resources. Because even if they don't feel like they have somebody, there is somebody who cares. Rural counselors, all kinds of different therapists that we have in the area, all kinds of different caring people, communities, organizations. There is at least one person that we can find that will reach out and connect with that youth.
Great, thank you. And then part 2 to that is the opposite end of the spectrum. So when a youth is really angry or upset and they burst out, you know, I want to kill myself, or I'm going to kill myself, or I just want to die. How do you balance addressing what they said and maybe feeling like that's just a knee-jerk reaction for attention? How do you balance that end of the spectrum? Paul gives me a shrug.
I have thoughts. Yeah, I mean, you know, bottom line is when you begin, you know, I get really nervous when people start talking about suicidal gestures and, you know, just attention seeking and so forth, because I've seen enough people die by suicide who were just last week, somebody said they're just attention seeking. Yeah, well, give it to them. Give them the attention. And, you know, it's false positives, yes, but, you know, that's the cost of doing business here if we're going to save lives. So you have to take it seriously. And, you know, if they really are, we all know that there are some who kind of, you know, probably don't really have any intention. But, you know, if you take it seriously, they'll stop doing that. If you start calling the police or taking them to the hospital every time they do that, they'll stop doing that. You know, that's one pretty extreme, but I mean, it really is. The watchword here is take it seriously. If they're looking for attention, give it to them. Give them the kind of attention that they need. And really be focusing on that whole idea of belongingness and burdensomeness. Those are such huge factors. And, you know, we've heard about, especially for adolescents, how everything is now, and they really don't have a very good future orientation, and the egocentricity of adolescence and so forth. And that is a risk factor, obviously. But the fact is, most suicides, youth or otherwise, are not impulsive acts. That's a bit of a myth, that the impulsive suicide. There are some, of course, but most of them, almost all of them, are planned for some time, with the exception of ones that are alcohol or drug fueled, which shuts down the frontal lobe and turns the brakes off sometimes. But it really just getting across to that youth that, you know, I heard this in my very first college seminar on suicide, that, you know, that suicide is a permanent solution to a temporary problem. Just getting that across to them, you know, trying relentlessly focusing on problems have solutions. We're here, buddy. We're here to help, you know, whatever it is you're facing. You don't have to tell me all about it, but let me tell you, problems have solutions, so we can get through this together. And I'm here to link arms with you, and we'll walk through this together, whatever it is. When you're ready to talk about it in detail, I'm here for that too, that sort of thing.
I've had a couple questions about bullying specifically, and so I'm going to kind of try to combine them into one question. Someone asked about whether bullying, leads to suicides, and I would just say that, as I discussed earlier, there's not like one cause of suicide. Bullying can certainly be a contributing factor, but in that, so since it is a contributing factor, what do schools do to try to address that bullying, and what are maybe some of the barriers that you guys face in addressing bullying? Because we know that you guys aren't the magic wand people that just solve things for everybody, right? So maybe just how you guys can address bullying, and maybe some of those barriers you face in that process.
Well, it's a twofold question. One of them is you definitely want to help the victim when you're talking about bullying. Because what looks like bullying to one student may not look like bullying to another. And the self-talk in their head that they're doing, that you're affirming that they're okay, that whatever it's the other person's problem. We look at the difference between rude behavior, being mean behavior, and bullying behavior. None of them are okay. Absolutely none of them are okay. We feel strongly that students need to feel safe, respected, and included. If they feel those three things at school, they're going to be better students, and they're going to be better people. So, that's one of the mantras in some of our anti-bullying curriculum that counselors use is, having students do those three things. They need to report it. If we don't know what's going on, we can't do anything about it. So, and that goes back to the bystanders. Bystanders watching what's going on, if they report that and see what's going on. So I just encourage them to go to a trusted adult. It doesn't have to be the counselor. It could be a teacher that they trust. It could be their coach. But report to trusted adults so that we can start the intervention process, so that we can start dealing with it. I know a lot of students say, well, if I tell, it's going to get worse. I say, well, then once we've told and it starts getting worse, then you come back right away, because then it goes to another level and it has to stop. It's not okay. We want our kids respected. So we try to do as much as we can to prevent, because we want our kids to learn and grow and be safe.
I'm going to take a little bit of a risk here. Most folks are adults, but my young friend Alexis is here, the ingenue and wonderful singer. And I just wanted to give you an opportunity, if you have something on your heart, mind that you wanted to say, particularly around that particular topic, or not, no pressure. But if you'd like to, we certainly like to hear from you. And you can come up here and take the mic. I know you know how to use a mic.
Hi, my name is Alexis Garjun. I have to say the bullying question was my question, and I have been bullied for the past, pretty much my entire life. I'm in 9th grade now. I'm going into sophomore year next year, and it's really hard for me to cope with that. I'll be honest with all of you, I've been suicidal. I've attempted it before, but it's so awkward being up there now. But I have to say that I think I've become stronger. I started going to Burl for counseling. I got the help I needed. I told my dad about an attempt I had made. I reached out. I was really scared about it because I didn't know if my parents were going to react the way I didn't want them to react. I didn't know if I was going to get the help that I needed, but I did. And I think honestly what I want to say is that there are so many things that go on in kids' life, and they have school, they have bullying, they have maybe family issues, and there are just so many things that combine, and that's what made me attempt it. That's what made me hit the wall. But if there were other peers here my age, I feel like I would tell them that suicide's not the only way out. yeah, I attempted it, but it would not be my way out right now, honestly. If there was something that hit me hard, I wouldn't even think about it. I would go to my dad, I would go to my mom, or I would go to my counselor. And I have to say that there's been a lot of stress this year as a freshman. I've been through so much. I've had just so much slander this year, and I've stayed strong. And as you guys are all here, I can tell that you guys are wanting to put an end to suicide. And, you know, prevent it from happening, especially with your kids. And I know that you guys have kids because I know you guys are sitting here to know what to look for your kids. And honestly, even when your kid is on their happiest day and they're smiling, ask them how their day was. Stop what you're doing, even if it's really important, paying the bills. Maybe take them with you to the bank and ask them how their day was, because I know that if I would have been going through what I did a year ago, that it would have helped me and I wouldn't have attempted that. I would have been like, you know what? This happened, and I would have ended up, you know, kind of popping like a bubble and pouring out to my family. To this day, it kind of helps having my parents there and knowing that I've been suicidal, and it helps getting it out and telling, so then they know what to look for as a parent. And there are days that I still go home sometimes and I go to my room and I cry because I'm going through a tough day. And my mom, she will burst into my room yelling at me to tell me what's wrong with me. She's the best. Me and her, we hit a rock. We really did. We went through a stage a while back, and then we became stronger as a family. I just think as a parent that you should be there for your kid. I mean, and I'm not saying that none of you guys are. There are parents that go through so much and they don't realize that their kids are going through a lot more too. And I realize now that most of you that are here probably went through the same thing as a teenager. You guys probably went through so much more than your kids have. And God, I'm shaking. I just wanted to say that that's pretty much all. There's just a lot. There's a lot to say, and I could write an entire book on it if I wanted to. But yeah, I really have to thank Pearl for being there for me, for my dad giving me the help I needed, and I'm really close friends with Paul. He's a really, really awesome guy, and he got me into counseling. My dad got me into counseling too, and they got me the help I needed. And so I think Burl is the best out of all choices. And if you guys know anyone, any other parents that have kids that are suicidal, I say recommend them to Burl, because Burl will help you. And it's a very safe place.
That's not why I asked her to stay.
I love you, I'm sorry.
Thank you, dear.
You guys just applaud her bravery. Alexa, you are so brave, and that is such a powerful message of hope. And I hope that you don't stop sharing that with your peers and those around you, because first of all, you're very articulate, and second of all, you have a powerful message. So thank you for sharing. Question for anyone from Springfield Public Schools: are student peer mentors giving any information or training on this topic?
I can say at Central, yes, and last year we actually had leaders from each of the 5 high schools and did the youth mental health training with them. That's something we're hoping to continue. So those kids are currently seniors this year, and for the most part, we're part of the peer mediation teams. So we are kind of targeting some of our leaders in the high school and asking them if they would be interested in this training. I think it's something that we're going to continue. So yes.
Thank you. It's appropriate that this question is written on a blue card, but has our panel members heard of the Blue Whale app? And if so, can you tell our audience what that is for those who don't know? And what do you guys think about that?
So it's an app that kids can put on their phone that kind of ends up taking over, starts threatening them. They have access now to parent phone numbers and student phone numbers and friend phone numbers and emails and everything they keep on their phone. And then it starts out as a game who can self-harm themselves more. If you do not continue to, quote unquote, up the ante, then threats start coming through this app. It literally kind of takes over their phone and then begins to threaten the lives of their parents and friends and family. If you do not continue to hurt yourself, we now have access to your world, basically.
It's scary.
Yeah.
And it's
Anybody else?
Yeah, it's bad.
Okay.
Yeah, it's really scary, and we just heard about last week. On the flip of that, I do want to tell you, I wish we had 13 more days of school, because on Friday I just saw that there was a high school that was doing a 13 reasons why not, and they had students on the announcements telling, hey, I had a bad experience, but there's good that came out of it, and this is a person who intervened with me, just like you did. I had interventions, these are the people that matter to make a difference. So it became, instead of spreading, why go that direction, what are the positives that made it? Like, I wish we would have had 13 more days of school so we could have implemented in our buildings, but I just like the flip side of that, of the positives, which goes with everything that you've been saying about that.
Thank you. So delete Blue Whale and download Panya. That's what I heard from that. It's good. This is a great question. So someone from our audience said that are gifted youth more at risk for suicide? My gifted children seem to struggle with social awkwardness and belonging.
So there are statistics out there that actually say that suicidality affects all youth, and even especially, not especially, but even the youth that are successful, that are the straight A students, that are the top athletes, that are the most popular, because a lot of times they feel more pressure to succeed, to exceed expectations, things like that. And the Signs of Suicide program that we implement in the health classes that they're talking about for SPS actually has a vignette about that. It's a popular student, and it addresses some of those stigmas so that it's not like we are targeting just the youth that may be socially awkward or maybe outcasts. We want everyone to feel like they can talk about what they're going through with a trusted adult, and that this affects everybody.
Thank you. So this is a question that I could probably answer, but I'll also open it up to our panelists. So the question is basically, if you don't live in Springfield Public Schools district, how do you get your school more on board with having these suicide prevention programs or having that conversation? My response would be to present them with the Signs of Suicide training and youth mental health first aid training options. We offer those in our 21 counties, so we can talk with anyone afterwards about where that is. But if you're here tonight and you drove less than 2.5 hours, I would guess that you are in our service area. So talk to us about that. But maybe, Rhonda, could you speak to maybe as a school administrator, what sold you on getting some of these programs in Springfield Public Schools? What meant a lot to you about doing it?
Well, because of the nature of the role of the school counselor, we are always looking for ways to prevent behavior that could be harmful or destructive to students. So within our counseling curriculum, we always are looking for new things that come about that have been part of a best practice, have been researched to show that it is a good curriculum to teach students coping skills. And so we focus on the preventative piece of that, and anything that we are able to latch onto from whether it's a partnership with CPO, with our other community agencies that can provide some assistance in that, because it is very expensive to purchase curriculum or purchase models of these programs that come out. So we certainly are going to take advantage of that. Also, the state of Missouri has recently encouraged school districts by passing some legislation that requires schools to begin implementing prevention programs in the area of bullying and youth suicide. Our district has been very fortunate that we've had those in place for a number of years, but for those of you that are in other districts that may not have been providing that, the state is now saying that within the next year or two they are going to have those programs in place. So you should be seeing more of those come up if your district's not already doing that.
Great, thank you.
My job is to travel and really get everybody in the community on board with youth mental health first aid and signs of suicide. So if you need help, I am more than happy to come and be an advocate and champion for you across our 21 county service area. So my cards are over on the table, and you're welcome to take one and email me, call me, and however else you can get a hold of me.
Thank you.
I think for the sake of time, this will be our last question. Is the Safe Place program still going on, and who is overseeing that program? And for those of you who don't know, that's those diamond signs that are yellow with the house, Safe Place. So who's overseeing that, and then do they train new employees on suicide? If a youth comes in presenting issues, are they trained? So who oversees that, and are they trained in suicide prevention?
I don't know. Can't answer that. Sorry.
Okay, we don't know, maybe we don't know to the who oversees that, but I think that is a great thing actually, and maybe Elena just got a new to-do list on her task list there. So I think that actually is a really great idea, is to reach out to Safe Place organizations. Community partnership is one, so making sure, and we have an internal policy that everyone has to go through mental health first aid, so we can reach out to other locations and find out. Does anyone in the audience know who oversees that? Rare Breed. Boom. Thanks, Krista. Rare Breed oversees it, and we'll be reaching out to Rare Breed to talk to them about that part. So, so that's a really, really great idea, and that's why these things are helpful. The only other thing that I would offer too, there's a question about what about the students who maybe aren't in 9th grade in this coming fall about being in signs of suicide, and that is again something that we will offer communities, whether it's in a school setting or it's just an outside meeting. We are happy to come and do signs of suicide training for groups of youth. We actually have talked a little bit about like Boys and Girls Club and reaching out to them and having them host some trainings, and so our desire is to get into as many locations as possible to get these trainings out there, so we have less students considering suicide here in our community. So I appreciate all of your time here tonight. I hope that it has been valuable to you and that you are walking away feeling like you have some tangible things. I would again ask, if you haven't signed in yet, there are sign-in sheets all over the place, and Chris Davis is holding a blank one. And so if you haven't signed in yet, please do so we have your information. We also have sheets over on this table that you can sign up. If you've heard us talk about youth mental health first aid over and over and over again tonight. I didn't mention this to all of them, but we actually have 4 or 5 instructors for youth mental health first aid here at the table, and so we really love that training. It is very valuable, and I think
Paul, you said it to me once that you're 20 years postdoc, but you still absolutely love the training because it's so incredibly simple and helpful for all of us, even someone postdoc, to use that curriculum. And so highly recommend. No one is above it is what that tells me, because I really respect the knowledge that you have. And so we have sign-up sheets. If we have upcoming trainings, they're offered every month. We have one next Wednesday, and then again on the 31st of May, and then some in June. So those sign-up sheets are over on this table. We'd love to have you sign up and attend one of those. Our panelists will be around for a few minutes if you've got any leftover questions, but we very much appreciate your time tonight. Thank you.